The views, comments, and opinions of the following program do not necessarily reflect those of Morris Media Studios, MorrisMediaLive.com, or its affiliates. Listener discretion is advised.
Good morning, good afternoon, good evening. Whatever time you're watching the show, you're in for a good one. Welcome once again. My name is Dee Nice. And for those that don't know how I do it, I'm going to let you know. We always bring you the best, whether it's in education, whether it's in health, whether it's in fashion, whether it's in fitness. No matter what it is, we have the answers for you right here on stage. And today is no different. I'm going to bring you a couple of segments of great people doing great things in our community. And so what we're going to start out with is our health show, and then we'll follow up with some entertainment as you have never seen before. So thank you for being with me. Sit back, relax, and watch with your ears. A special thanks out there to Brother Jason Kelberman, DC, my doctor friend, still working even as we talk right now, going into the holiday. But like I said, man, guys, wear your mask, socially distance. As of yesterday's news report, it was unveiled that 1 out of 80 people, imagine that, has COVID. Now, you imagine how many people in LA, and if you're counting them, you would get drunk trying to figure out how many people that entails, right? But look, we're trying to stay alive, and we're trying to show you how to do that. So today's no different on Health from the Inside Out. We're bringing you a young man I had a chance to meet, and the pleasure of meeting this young man, because he was talking about something that concerns millions of America today, and one day, believe me, it's going to catch up with you. Well, it's about knocking on my door, and it's all about the Medicare. Okay, that happens when you get to 65 and over, for those that don't know. So I found this guy that was actually sitting down and talking to people about the different supplements and how to choose the right plan, how to tailor it to you, and how to make sure you get all that you can out of your health insurance. And ladies and gentlemen, he has blessed us by being able to come on the show tonight, and he brings experts, he brings in advice, he brings in everything you need to figure out how to find your way through this thing called Medicare. So without any fanfare, I'm going to bring on my guy and yours to be after this show, Mr. David Do. Dave, thanks for coming on, man, and sharing with me. Man, when I met you, man, you had your book slide out. You were just meticulous about how you laid it out. I asked you a few questions about the Medicare because that's coming, and I have a lot of people that want to ask about how it works. How do you get involved? How do you get the best deal out of it? And none of these questions were I able to answer. So I said, you know what? When I can't find answers myself, I'll seek out people that have the answer, and hopefully they're able to share with me and others. And tonight's no difference. We brought you on to be able to debunk some of the myths behind Medicare. Now, was I right when I said you can only start looking at this when you're about 65 or something? Is that
right? For most people, that's right.
Okay.
However, there are a few individuals that can qualify for Medicare at any age. And basically, that's with certain disabilities.
Okay.
So typically, if people get their Social Security disability income, and they have that for 24 consecutive months, then they'll get their Medicare automatically on the 25th month. But it has to be consecutive.
Okay, got you.
So that would trigger it at any age.
Okay, that's automatic trigger.
Right.
Okay, got you.
But other than that, yes, for everybody else, 65.
Right.
So basically, people try to start it early, right? But you definitely want to do it 6 months before.
Okay.
Your 65th birthday. That's usually the good time to go over that and then see what your options are. And that's kind of what I do in the community. Gotcha.
Now, how do you get started? I mean, is it something that they automatically make your phone call and say, look, it's almost that time? Or do you have to just basically just kind of meander into it?
Right. So there's typically two camps. So number one, if you're already receiving your Social Security benefits, then since you're already in the Social Security system, then you'll get your card automatically. So you wouldn't even have to apply.
Okay.
Now, for most other people, especially now, people are still working. So you have to basically, you're still not retired, you're not getting your Social Security, then you do have to apply through Social Security.
Through Social Security?
Yes.
Okay.
Now, there's a lot of people that either try to, there's a lot of advertising and saying, get your Medicare A and B benefits, but you definitely have to go through Social Security.
Okay. Now, let's stop for a second and go back for those that don't understand. What is A and B benefits?
Right. So Medicare Part A is for hospital coverage.
Okay.
So Part A is like, and I don't know if anybody can see that.
Yeah, just put it right up on again.
But essentially, Part A covers your hospitalization, and then Part B is your medical services. So Part A, in order to be eligible, you have to have 40 credits, which is basically 10 years of taxes that you paid.
Okay.
For your working years.
Okay.
So as long as you have that 10 years, then Medicare Part A, you've earned it through your taxes. Right. So that's most people, right? I mean, 10 years throughout your working career, right? So Part A, that's included since you've earned it. Now, Part B, for medical, everybody has to pay into it once you start it. So currently, the base premium is $144.60. That's due to increase actually next year to $148.50. But that is the base premium. Now, for people, their incomes are in a higher bracket, that could be higher. So you would have to, Social Security will calculate that. It's a little complex, but basically they go back from your tax return 2 years ago to determine that. But for most people, since they're, retiring, you would get that base premium. That's your monthly cost.
So now, okay, take, for example, let's go on the far end of the spectrum right now. If you have somebody that hasn't worked 10 years consecutive, say, for example, they took some time off or they got hurt or something like that, and then they were out of this, and then they went back into the job performance and then they got hurt again or something like that. This is just maybe an extreme or whatever. Now, how do they compensate for that? Is it 10 years straight that you got to do, or is it regimented, or there's ways to circumvent different things depending on the situation?
Yeah, typically they do say it's 10 consecutive years.
Okay.
However, I have seen cases where even if it was broken down or spread out, where you didn't work 10 consecutive, like 2 here, 3 here, as long as the cumulative is 10 plus,
Gotcha.
Some people actually have seen their, and you can go to mysocialsecurity.gov to create an account. That way you can check where your status is on that. So if they look it up and say you're eligible for Medicare when you turn 65, that's pretty much your golden ticket to get in. So although it does say consecutive, you would definitely want to consult with Social Security to see where you stand on that. But yeah, generally it is 10 years consecutive.
Now, we were talking earlier about sometimes when you do your own research and because a lot of advertisement is out there right now. Right. But also there's a lot of confusion too, because you have an administration that in the background has from day one of 4 years ago been talking about getting rid of what we consider and call Obamacare, which is the, California, the CARE Act and something like that. Yeah. So it's confused and murkied the water quite a bit. So how do we cut our way through that? Is it still depending on what the government looks like? Is this something that's going to be around with this Medicare? Or is there any chance that somebody's going to say, you know what, we ain't going to have it no more? They tried to get rid of Social Security, and so that didn't work. So, in a volatile type of environment politically, how can we be solid in being able to say, okay, when I get a certain age, I'm going to have something that I can just, go to the hospital if I'm sick, especially with COVID and stuff like that now. You got to have some kind of help.
Yeah, a lot of people are concerned about that, but I think rest assured, Medicare and Social Security is here to stay. And any politician or anybody who's kind of trying to take that, especially from a lot of seniors, they're probably not going to be voted into office because let's face it, the senior community, they don't want their benefits taken away, especially
Correct.
the ones that are entitled to those benefits. I highly doubt that would ever happen.
Right.
As far as somebody who would decide to get rid of those two benefits.
And then they have existing proponents that they have on their
Right.
conditions and things like that. So how does that kind of work into this Medicare situation? Is there a restriction of what you have, medications and all that determines what you're able to get?
No, actually, that's why it's important, the timing of it. When you're first eligible for Medicare, turning 65, that window of opportunity gives you that guaranteed acceptance.
Okay.
So you basically have 6 months before your birth month of 65 and 6 months after. So within that 13-month period, you basically have a guaranteed acceptance into any kind of Medicare plan. So there are no pre-existing conditions for that.
Okay.
Now, however, and I'll kind of break it down because
Please.
there's also, obviously, with Medicare, we talked about Medicare A and B. But if you look at option 1 and 2, there's basically two different choices, and you have to pick one or the other. Now, if you look at option 1, that's where the Medigap or Medicare supplement. And this is kind of where we talked about pre-existing conditions. This is the plan where you can get all your coverage without any health questions within that 13-month window. Now, obviously, it's not gonna start until your Medicare is active.
Okay. Yeah.
So typically, it's gonna be your birth month, right? So, but the timing is critical there that you have to apply during that window, so you won't be liable for any health questions or getting into that. So that's very important. Now, you also have a Part D with prescription drug coverage. So you need to get that separately since it's listed there in different boxes. So typically, since this is through a private insurance, this is not through Social Security. That's kind of where I come in as an insurance broker, and I help people find the right plan for option 1, right? So now option 2, this is a Medicare Advantage plan, and basically this kind of ties in your Part D together. So the Part D is kind of built into the plan. So it's a different choice for a lot of people. And there's basically an HMO and a PPO version, right? So you kind of have more choices as far as the different type of plan it is. And in some cases, depending on the county too, you want to make sure what your choices are because every county has different options. So I know for some of the local viewers here, we're in LA County, Los Angeles, and there's a lot of choices here with their Medicare Advantage. So depending on the county where you live in, you definitely want to look at what your choices are. And Medicare.gov is a very good resource for you to find what choices are available in your area. Okay. So
now you mentioned PPO versus HMO. For those that don't even know what those acronyms stand for.
Right. So HMO stands for Health Maintenance Organization. Basically, it's called managed care system, where you basically have to select a primary doctor. So once you select your primary doctor, then you have to go through an authorization or referral process, so that you would first have to go to the doctor to get approvals to see your specialists. So in a sense, your primary doctor is kind of like your gatekeeper, and that doctor refers you to see, for example, a cardiologist. So you would have to see that doctor first. It's more of a cost-saving measure.
Okay.
And so typically, a Medicare Advantage HMO plan, typically the monthly costs are much lower than their PPO counterparts. But yeah, you have to go through that system. So in a PPO, that's where you have more choices and without a need for referral. However, you have different share of costs. So if you go to an in-network doctor or an in-network hospital, then your share of cost is lower versus if you go out of network. So you do have more flexibility there. But again, you have to pay more share of cost for that. So that's kind of the major difference between HMO and a PPO in the Medicare Advantage side. Yeah.
So when you get a doctor, is it important basically to know what kind of network he's involved with and find out his downline? So you still have to do homework beyond getting a doctor.
Exactly, and that's kind of where I also help the member or the beneficiary to pick which option is the best for them, because everybody's very different as far as what their needs are. So as far as like the prescriptions that they take or a particular doctor they want to see, and of course their budget, right?
Yeah.
It all costs money, right, for healthcare. So those are some of the factors that I look at when I try to advise or consult with the client and see which plan would be the best fit for them.
So if you find a couple and they just retired and they've had pre-existing existence and they're retired, and so that means there's not steady income coming on, that's big income, they might get whatever little subsidy they're getting, then they can still qualify for any of those projects, but the PPO is basically off the table because they couldn't afford the price of the PPO. So it's best that they kind of like find something within the HMO, but something, so they have something, is it tiered for somebody who doesn't have any money, but maybe say, for example, let's say under $20,000 a year, okay, between husband and wife, then are they able to be covered? Or do they have something that low to have, or do you have to have a certain immunity before they even try to give you somebody?
No, actually, depending on the county that you live in, there are some affordable PPO options versus HMOs. So there might be very low monthly premium for a PPO plan in your area, but you definitely want to do your homework as far as what are the pros and cons versus a PPO, because even though the upfront cost might be low, in that instance, there are some copays or out-of-pocket costs that you have to deal with down the line. Okay. So I'm kind of wary as far as if I'm consulting with one-on-one with like a couple you said, how often they see your doctors. Do they have any chronic conditions that possibly, could cost more down the line with a PPO, whereas in HMO managed care, they would have a little more less share of cost for seeing a doctor or a specialist for their chronic illness. And then plus it saves them on those visits or hospitalizations, et cetera. So yeah, it all depends on what doctors, any kind of special needs that they have, and that will help me determine what direction I can recommend for them. So yeah, two people are not the same, especially even in a husband and wife scenario. One might be healthy, one is not. So they could end up with different plans because that's the best fit for them, right? So again, they don't have to go for the same insurance. They could all be completely different, since Medicare is an individual plan. It's not a family plan like before when they're working, right? Where it would cover the family.
Right.
Medicare is not like that. It's individual. So they can go each in their different direction based on their health needs. So that's really how I do that with that husband and wife dynamic.
Have you run into well, I'm sure you have, more than a few times, have you run into people that basically tell you, well, son, by the time I get through with everything I have, paying my bills and just, keeping the lights on and gas and some food in me, then all I have maybe is maybe $100 a month.
Right.
You know what I'm saying? To my name, period.
Yes.
And are you able to deal with people like that? Does that?
Oh, absolutely.
You've seen people like that? Oh.
I mean, especially, and again, healthcare is local. So you definitely want to work with somebody that's local in the area, because that local agent will also be able to know what local programs, not only federal level, but state or county level, different financial programs through the state or government that can help them with some of those costs. Like, for example, extra help or low-income subsidy. That's something that if one can qualify for, it's basically based on their income and resources. There's a threshold for that. And an agent like myself can help them see if they're eligible or qualify. So programs like that would help pay for things like prescription drug coverage, so that they wouldn't pay what most people pay if they're eligible based on their income and other financial status. So that's something that you can kind of you don't want to just say, "Oh, how much you make?"
Right.
Like,
Right.
That's something that people are not comfortable with saying.
Right.
But you can kind of tell them, do you make under
Okay.
$2,000 a month?
Mm-hmm.
Make it less threatening, but also you're trying to help them to see if they can qualify,
Mm-hmm.
right? So those are some of the things that local agents can help them with, and they're aware of local programs and especially the different types of plans that are available in their county. So I know there's a lot of advertising, especially with COVID right now.
Everywhere.
Yeah, on TV, right? In the mail.
Yeah.
People get all these things. But I tell you, especially those people that if you call that number, who knows where they're going to be located, right?
Yeah.
They might be on the other side of the country. They don't know the local doctors and plans like a local agent would.
Mm-hmm.
So that's something that I would really, really encourage Medicare beneficiaries, especially for the first time, to find somebody that's local in their market. So that way.
And then
I have a question. I
Yes.
was listening to you earlier when you were talking about the qualifications for Medicare. As a working person at 65 years old and you retire and your company is covering you for your medical insurance, do you
Right.
still have to apply for Medicare?
Well, that's a very good question. I'm glad we touched on that because there's two ways you can do it. Now, if you have employer coverage past 65 and you continue to work, you can do so, definitely. Now, I would most likely encourage those to at least get Medicare Part A, though, through Social Security. And since B, you can delay your Part B once you decide to retire or your health plan with your employer is ending. Because Part A, since I assume you've earned it through your working years, that is still something that I would recommend you apply through Social Security and tell them you just want Part A and not B. You'll delay Part B until your coverage is ending. Now, the other way you can do it also is, depending on your plan with your employer, I mean, some plans, they're all not equal, right, as far as the coverage and the cost. So you definitely want to do a comparison. And like I said, a local agent like myself can also kind of give you that guidance too. So, for example, if your employer plan, not something that you like as far as their options, you can always compare that with a Medicare plan, see which plan would be cost versus benefit,
Right.
a better option than your employer plan. So you can still work through that and see which direction you want to go. You can keep your employer plan and then decide to delay Medicare once you retire.
Okay. One last question. As a working person, I've hit 65 years old already. Am I going to be penalized because I didn't apply for Medicare because I'm still working?
Yes, that's the other thing. I'm glad you brought that up too. So now Medicare doesn't know that you're working past 65. So once you do retire and you decide to get Medicare B later, they will assume they'll just assume that you didn't work. So you just need to coordinate with Social Security and say, I've had coverage, continuous coverage since your 65th birthday, all the way until the point where you decide to end your coverage with your employer plan. So during that time, as long as you had continuous coverage, and it is called credible coverage, meaning it's at least as equal to a Medicare plan as far as the benefits. And that's something that you would want to talk with your human resources just to make sure. And then once you verify that, then yes, you basically can avoid that penalty, late enrollment penalty with Medicare. Just as long as you basically give that proof of coverage to Social Security or Medicare once you decide to join it at a later date.
Okay, thank you.
Sure.
Wow, that was great questions, man. Great questions.
Absolutely.
Because you know what I'm saying? Because we're trying to answer the questions of people that are there, people that are getting there, people that are working, people that are not working, and we pretty much covered a lot of it. Now I have another guy that's a pharmacist, and he got caught up trying to do the inventory today because it would have been a good conversation for the pharmaceutical aspect of it. And as you come on later in next year, you know what I'm saying, when we start the show back up again, then he'll be on to join us to talk about that prescription part of it. Now, but you're saying there is a part of it that helps to offset some of the, because prescriptions, man, are crazy, dude. I looked at some of the prices, and some people saying like, I'm spending a couple $100 on this one particular drug, and I'm like, who does that? So is that anything that that is going to be regulated? Can it be regulated, or is that a situation to where if you get the right benefit package, then it depends on how much they'll absolve?
Yes. Again, I went back to that program called Extra Help or Low Income Subsidy. That's a very powerful tool, but yeah, again, not everybody can qualify for that based on their earnings or even after retirement, because they count your Social Security income as part of that threshold. So there are a lot of people that won't even qualify for the Extra Help or Low Income Subsidy. But yes, there are other solutions. Like, for example, the pharmaceutical manufacturer of that prescription drug, there are some financial help programs through the manufacturer. And if you determine what the manufacturer of the drug is, now this is a first come, first serve, so it's almost like a grant, but you can basically apply and see if you can get a very low copay for that particular drug. That's one way to do it. And then the other way is, there are certain plans that are tailored for certain people with certain chronic conditions. Like diabetes, obviously, is a big one.
Right, yes.
So there are certain plans that have what they call a chronic special needs plan within a Medicare Advantage plan, the option 2. So that plan would be, there are certain prescriptions that are highly used, for example, insulin, that could be in a different tier where it could be in a much lower copayment. So that would be something that a lot of people can, and especially within a local agent, they can find that special need and then put them in that right plan. So it's like a matchmaking process to make sure that they're in the right plan. To get those benefits.
And so you'd be one of the gatekeepers. You'd be the first step somebody want to call when they have need to go there. Or they're coming out of some disastrous situation where they had maybe Medicare and they ended up going backwards.
Yeah, exactly. Because during my needs analysis, I look at all their prescription drugs that they're taking, and then based on that information, I can find a plan that would, especially those high-cost medications, there are some certain solutions that would really alleviate that cost, even if they don't qualify for certain programs based on their income. So yes, there's a lot of different ways we can work around that. It's just that a lot of people, like you said, who've been on Medicare for years, they may not have that local agent that they can talk to, right? Because if they call an insurance company somewhere, in the other side of the country, they're not going to know what different plans are available. Because as I said, different counties, not even different states, have different available options and plans, choices. So that's where I come in and help people and walk them through that.
And I thank you for coming in and, saying time flies when you're having fun. And so I do not want to get out of here without you being able to tell people how they can catch up with you and your valuable services that you're able to provide.
Yeah, so again, like I said, that health insurance, especially Medicare, is local. So for people that are and basically I'm licensed in the state of California. So I am able to reach the entire state of California. But yes, they can definitely reach me at my phone number is 310-995-7186. And my name is David Do. And definitely I can help the local, Southern California especially, that's my local market, and to help people do a one-on-one. And like I said, I do in local communities events as well. So I'm in a lot of retail environments. That's where we met, right?
Right, yes.
So yeah, there are ways we can meet either face-to-face or especially during this COVID over the phone. And so that way it could be safe for everybody.
Got you. Get a number one more time.
So phone number, again, this is David Do at 310-995-7186.
Good. And when it kind of slows down a little bit, then there are some retail places where they can catch you. Are they steady or is there a schedule?
So since, especially for the Medicare eligibles that have been on Medicare at least a year, there are open enrollment periods. So I'm glad you brought that up because that's very important. That's when they can decide to change or do an annual review of their plan to see if they're in the right one, or we can do some fine tuning with their costs and benefits.
Mm-hmm.
So that those dates is very important, from October 15th through December 7th of every year. That's the Medicare annual election period. So that year, that's the time window that they have. Everybody who's on Medicare already, that's the window, and you probably get a lot of advertising during that time, because
too much.
That's when people can change.
Right. Got you.
So that's the time that most people get into, those advertising, or they might look at some different meetings. Although now with COVID, there's not as much community meetings that there are now. And that's why someone like me, who's local and in the local community, in these retail environments, we're still able to service people face to face.
Got you. Well, are you able to list some of the retailers that you're at?
Yeah, so I'm at the Walmart in Torrance on Hawthorne Boulevard. That's my primary. It's like my office.
Right,
really.
Right. That's where we met.
Yeah, that's where we met. And so, I'm going to be there during the annual election period every year, pretty much. So,
got you.
Yeah, they can definitely come see me there, and then I can definitely help them out.
Right, and that's the one by the Delamo Mall, for those that don't know in location-wise, at the Walmart there. Man, I really appreciate you coming down. That advice was invaluable, man, and we all need to hear it, because we're all sooner or later not going to get to that age that we need some help. So thanks for coming in, you guys. Thanks for tuning in. I hope you learned something. There's a number and an email at the end of the show that you can always call us and figure out what you need. Any questions, we can direct it to David. And just take care of yourself, man, because like I said, this COVID is no joke. Make sure that you mask up, you give that social distancing, and don't be so caught up in the holidays that you forget to take care of yourself, because the life you save may be mine, okay? So until next time, this is Dee Nice along with Mr. David Doe, and from Miss Alexander, Monica, Miss M, and all the other people that have helped to make this show a success, Dr. Kelberman, Dr. Cutter. Hey, this is health from the inside out. Make sure you start from your inside and make sure that smile can radiate to the outside. Until next time, we'll see you.
Heaven must have known that this day would surely come along.